Stay off the streets, the French have been told. Yet for the homeless, that's an impossible situation to be in. Doctors' Charities are warning that those in the most precarious situations are perhaps the most vulnerable to the disease.
We have a camp of 500 people in the streets in a very bad sanitation condition, of course, and with the risk to have some issues regarding coronavirus. Of course, we need to provide everything, to do everything possible to ensure that they can get access to care and they can get access to shelter to avoid epidemics.
In the last few days, there has been evidence of the authorities rounding up homeless migrants as part of the fight against the virus. But the reality is that they are likely to be transported to shelters or gyms with hundreds of others. So while the official advice is to self-isolate, they won't be able to. If a single person already has the virus or is a carrier, that could be catastrophic.
We need to monitor the situation and to have an overview of all the people living in the streets, to have clearly some associations capable to take care of them, and in particular, of course, the French government to ensure that we have shelters provided very quickly. We need to have centers for positive cases as well, medics, and all the equipment. And we are actually in France in shortage of masks, gloves, and everything to take care of the people and to ensure the security, health security of the medical staff.
That concern spreads beyond France. On the Greek islands, where thousands of migrants are packed into camps without access to basic hygiene facilities, even the simplest of preventions, washing your hands, isn't easy. While in Germany, the police had to intervene following a brawl at an asylum seeker centre. More than 500 migrants were placed under quarantine in Seoul after one resident tested positive for COVID-19.
There have been significant disruptions since the start of the quarantine measures, which is why 17 people who significantly ignored the quarantine have now been moved to another facility.
The domino effect of the lockdown and the fear of infection has also hit food distribution. Many charities are struggling to carry out their activities following a sharp drop in volunteers.
Many volunteers cannot continue their work due to age or health constraints. We're experiencing an exceptional and unique situation.
Places have been made available to shelter people, but there simply aren't enough. And that's been made pretty clear to me as we've been working across the city of Paris during the COVID-19 pandemic. People are still living on the streets here. Now, while perhaps in more saner times, the idea of having shelter for the night may have been the priority for the homeless, the growing fear of being on lockdown with hundreds of others, some who may already have the virus, means sleeping rough may just for now be the safer option.